We had thought initially, and again, so many of what the initial information we had turned out not to be correct or turned out to be modified. But we were laboring under the impression that young people were not affected by COVID-19. And that was actually good news, right? The vulnerable populations were older people, people with comorbidities. But one of the few rays of good news was young people weren't affected. We're not so sure that that is the fact anymore. Toddler, elementary school children are presenting symptoms similar to Kawasaki disease or toxic shock-like syndrome. Now, these are children who come in who don't present the symptoms that we normally are familiar with COVID. It's not a respiratory illness. They're not in respiratory distress. And I think that's one of the reasons why this may be getting discovered this far into the process. It's more an inflammation of the blood vessels, which can then cause problems with their heart. And there are 73 cases that the Department of Health, Dr. Zucker, is now studying. But the illness has taken the lives of 3 young New Yorkers. So this is new, and it's developing. The Department of Health has communicated with the federal officials, the CDC, and the CDC has asked New York to develop national criteria for this so that other states, other hospital systems can also be checking into this and looking into this. Again, as it turns out, these children happen to have the COVID antibodies or be positive for COVID, but those were not the symptoms they showed when they came in to the hospital system. So it's still very much a situation that is developing, but it is a serious situation. The Department of Health is also going to be working with the New York Genome Center and Rockefeller University to conduct a genome and RNA sequencing study to see if there's something about these children that may present a definable situation.